For decades, doctors have believed that once cancer cells go dormant, once they go into a kind of sleep, they become harmless. Like seeds buried in dry soil, they can sit quietly for years, even decades, causing no immediate threat. But here's the shocking truth. A new study published in Nature has revealed that something as common as catching the flu, or even COVID-19, might have the power to wake those hidden cancer cells back up. Think about that for a moment. The virus you dismiss as a seasonal flu could, in some people, act like a gust of wind, reigniting dying embers and a campfire, sparking cancer cells back into activity even years after treatment. This is not fear-mongering. This is peer-reviewed science. And today I'm going to explain to you, step by step, what this means for patients, survivors, and all of us. To understand this discovery, we first need to talk about something many people don't know exists: dormant cancer cells. When we treat cancer with surgery, chemotherapy, or radiation, we often believe the job is done once the tumor is gone. And in many cases it is, but cancer is clever. Some cells manage to escape the initial treatment. They leave the main tumor site and travel through the bloodstream or lymph system, settling in other organs. Instead of growing immediately, these cells go quiet. They stop dividing. They blend into the body's natural environment, becoming almost invisible to the immune system. Doctors call these disseminated tumor cells or dormant cancer cells. Think of them as seeds blown off a dandelion. The flower may be gone, but those seeds can float far away and land in fertile ground, waiting for the right conditions to sprout again. This is why some people who are declared cancer-free experience a recurrence 5, 10, even 20 years later. The cancer didn't come from nowhere, it came from cells that had been asleep, waiting. And now, scientists believe common viral infections might be one of the triggers that can wake them. In July 2025, a team from the University of Colorado Cancer Center and Montefiore Einstein Comprehensive Cancer Center published a groundbreaking study in Nature. Their focus was breast cancer. In their mouse models, they had animals with disseminated, dormant breast cancer cells sitting quietly in the lungs. These cells weren't causing any active tumors. But then they infected the mice with either influenza or SARS-CoV-2, the virus that causes COVID-19. The result? The inflammation caused by the infection reawakened those silent cancer cells. They began dividing again. Tumors started forming. Lead researcher Dr. James DeGregori described the phenomenon with a powerful analogy. He said it was like a campfire that had burned out, leaving only hidden embers. When the wind blows strongly, those embers flare up again into flames. In this case, the wind wasn't literal, it was the storm of inflammation caused by the viral infection. It's important to note, not every dormant cell turned into a tumor. And once the infection resolved, many cells went back into dormancy. But the temporary reawakening was enough to raise serious concerns. For cancer survivors, this raises an uncomfortable but urgent question. Could a common virus actually raise the risk of cancer coming back? So how does this happen? How can something like the flu or COVID, which primarily attacks the respiratory system, affect dormant cancer cells hiding elsewhere in the body? The answer lies in inflammation. Whenever you get sick with a virus, your immune system mounts a defense. It sends out chemical signals, cytokines, interferons, growth factors to fight off the invader. This immune response is like an alarm system. It doesn't just target the virus, it changes the entire environment of your body. Blood vessels dilate. Immune cells flood tissues. Repair signals are sent out. Normally this helps you heal. But dormant cancer cells, sitting quietly in tissues like the lungs or bones, are highly sensitive to these changes. Imagine a seed lying in dry soil. It does nothing until rain arrives. Inflammation is that rain. It provides the signals, the nutrients, the molecular fertilizer that tells the seed, or in this case the cancer cell, it's time to grow. That's what the Colorado and Montefiore researchers observed. The viral infection created an inflammatory storm, and that storm shook the dormant cells awake. Now, to be clear, this does not mean every time you catch a virus, you're automatically reactivating cancer. The risk depends on the type of cancer, the state of the immune system, and the individual's history. But it's a reminder of how interconnected our biology really is. So why is this such a big deal? Because millions of cancer survivors worldwide live with the possibility of recurrence. For some cancers, like breast cancer, dormant cells are particularly common. A patient may finish treatment, celebrate remission, and return to normal life. But those hidden cells remain, silent, undetectable by scans, waiting. If something like a common flu infection can potentially wake them, it adds a whole new layer of concern for survivorship care. It also raises the question, who is most at risk? The study focused on breast cancer, particularly cells that had spread to the lungs. But the principle could apply to other cancers where dormancy plays a role, such as prostate cancer, melanoma, or head and neck cancers. It may also matter more for people with weakened immune systems or those whose bodies are more prone to strong inflammatory responses. In other words, not everyone is equally at risk. But the concept itself changes how we think about cancer survivorship. If you're a patient or you love someone who is a cancer survivor, this news may sound frightening. But let's ground it in practical takeaways. First, vaccines matter. Preventing infections in the first place reduces the chance of triggering unnecessary inflammation. Flu shots and COVID boosters aren't just about avoiding illness. They may, indirectly, help protect against reactivating dormant cancer cells. Second, inflammation control is key. Some researchers are already exploring whether anti-inflammatory drugs or targeted therapies could help reduce the risk of recurrence linked to infections. Third, stay in follow-up care. Cancer survivors should continue regular checkups, report any unusual symptoms, and maintain open communication with their healthcare team. This discovery doesn't mean we should live in fear of every cough or sneeze, but it does mean we should respect how complex the body is and how factors outside of traditional cancer treatments can play a role in long-term outcomes. The study we're discussing is just the beginning. Scientists now want to know, which types of cancer are most vulnerable to this effect? Are certain patients genetically more susceptible? Can we predict which dormant cells are more likely to wake up during inflammation? And most importantly, can we develop treatments to prevent it? Some early ideas include using targeted anti-inflammatory therapy during viral infections in cancer survivors, or designing vaccines that not only fight viruses but also minimize inflammatory spillover. We're also likely to see clinical studies where cancer survivors are followed more closely after viral illnesses to track whether recurrences are more common. This is how science evolves. One discovery raises 10 more questions, but each answer brings us closer to understanding and protecting patients. If you're listening to this and you're a cancer survivor, let me speak directly to you. This study is not a reason to panic. It is a reason to stay informed. Your cancer is not guaranteed to come back because of a flu or COVID infection. Most people, even in the study, saw their cells return to dormancy once the infection cleared. But what this discovery tells us is that vigilance matters. Preventive care matters. And your immune system, your overall health is part of your cancer journey long after treatment ends. So take the flu shot, take the COVID booster if recommended. Protect your body from unnecessary inflammation. Think of it this way. If dormant cancer cells are embers, then your job, with your doctor's help, is to avoid the winds that might reignite them. Science is giving us the knowledge. Now we must use it wisely. If you found this explanation valuable, please subscribe for more real medical science explained in everyday language. And if you know someone who has survived cancer, share this video with them, not to scare them, but to empower them. Because the more we know, the stronger we become in the fight against cancer.